morning, everyone. What a welcome by Dylan. And Dylan was thinking 10 years. But today, as well, we'll be reflecting on the past 3 years and thinking maybe a bit of the next 3 years. I'm Dr. Stefan Buttigieg. I'm the co-founder of Digital Health Malta, and I'm the host of the Digital Health Voice podcast. I wear a couple of hats, but I'm going to focus on those two today. So, kicking off our conversation, the first thing that I have for you guys now is this. How has your past 3 years shaped your digital health journey? And I want to start off the conversation possibly with Prof. Grech, who is, your favorite pediatrician, but he is also have a special interest in pediatric cardiology. Go for it, Vic.
COVID changed everything. So, as you know, we had to go for online consultations, but then, if we can put up the slides, this was the way things were in the past, yeah? WhatsApp messages, good morning, has this the next slide, sort of thing. Next slide. So these slides represent what I get to see. Rashes. There was one of a dirty diaper that was sent yesterday during dinner with my colleagues. So this is the kind of thing we used to face, that we faced more with COVID, and now we're back to normal. It's more of this same.
Yeah, so we're seeing more of a continuation of this rather.
Health. With regard to WASP, I don't even want me to talk about that.
Go through that quickly.
I'd run a course called Write a Scientific Paper, which I've been doing since 2010, and what has changed for me is that going digital, I now have an international faculty. Now everyone thinks nothing of it. And I also have international students. So I have speakers from the Americas, from Africa, from the Middle East, from the Far East. A truly international course with journal editors from everywhere.
Wow, thanks, Prof. We're looking really now, not just it's something that has to be physical, even though it comes with its magic, but something, beyond and expanding our horizons, looking beyond our comfort zone. Markus. Markus is Chief Technology Officer at 𝐂𝐿𝐼ve GmbH, because that's how they name their companies in Germany. But tell me more, how was your journey in the past 3 years?
Yes, so I'm originally from Germany, but I moved to Malta 13 years ago.
Okay.
And my father and I set up the 𝐂𝐿IVe service in 2013 to cater for health insurances. So anything a health insurance does or a government entity, we do the same. We're licensed for it. Every aspect from data center to call center to software development for the government. We just do it, since we're private, more efficiently, faster, cheaper, better. And that's why they outsource to us. So we apply for government tenders, and when we win them, then we service the government. And in this respect, in the last 3 years, we mostly had government paperwork, casework, stuff like that. Yes, we had some technology, setting up data centers, but it wasn't that. And then the pandemic hit, and we developed Germany's first vaccination passport, the 𝐂𝐿IVe Pass, which was used in Bavaria by 3 million people until the official IBM solution came half a year later. So you can see how fast we're moving. IBM, global player, and we were half a year faster to the market than them. They just had better government contacts, that's why they got it. But that's how fast we moved. And since then, we kept the software development part, and now we create video platforms where patients can speak with doctors, for example, to avoid this WhatsApp situation, because in some countries like Malta, that's totally fine. And I see it because I have company in Estonia, in Malta, in Germany, in Switzerland. And they're legal different aspects. For example, in Germany, this would be highly illegal to communicate via WhatsApp because health insurance data is a certain amount of protection that's needed. And you actually, for example, even our video software, which is working kind of like Zoom or WebEx, needs to be especially certified. So there are only around 60 companies in Germany that are legally allowed to do that. And now we try to export it to other markets. But Malta is obviously a lot faster moving, again, smaller size. Like you say, small country, big balls. In this case, small country, very fast moving, and that's why we try to combine the fast moving of Malta with technology quality of Germany.
Fantastic, Markus. I mean, I see this this disconnect sometimes, but I also see an opportunity to learn from each other. Definitely, private sector, public sector, to get things moving a bit faster. And now I want to move to Mattia, Caruson. And what really struck me about the conversation I had with Mattia is that he's the CEO of Mama Health. And I'm like, why Mama out of all names? And he said, don't you remember your mama was telling you like and taking care of you? She was the wise person. And it really struck me. And Mattia, we had a conversation before this conference about data. And I'd love to hear your thoughts about the past 3 years, Matt. What do you think?
Yeah, sure. So I think, 3 years ago, I was working in the pharma industry. I was working with global health, pharma companies, trying to kind of shape their move into this like new healthcare, new future. And one thing that I really started realizing, actually really 3 years ago, was like this changing in the role of the patient. From in the past, there was a very paternalistic approach in which the doctor tells the patient what to do, and that's it, right? The patient is not really in the equation. Also for a pharma company, as a pharma company, you build a drug, and then you make sure that doctors prescribe the drug to the right patients. Like the patient itself is not in the decision making, is not in the equation for them, right? So, but this is changing, and they are seeing this is changing their dynamics, their business model, but also the day-to-day operation in the healthcare system, right? And so this was probably, the starting to my drive to say, okay, patients want to step in. Finally, they can have the resources, but probably they still lack a good access to the information or what they need to actually step up, become the patient that is actually, at the same level of the doctor or kind of play a big role in managing their care. And that was my drive, for 1 year and a half ago, moving to building Mama Health. And probably coming to...
Sorry, Mattia, remember that good one? Yeah, I should tell.
Yeah, but probably one of the starting point was like, okay, how do we make patients able to actually play a role? And the first thing I was thinking was like, okay, they need at least access to their data, right? How can you manage your care if you don't even yourself have access to the data? So I said, okay, let's try to help them get access. And what I did is I tried myself. I reached out to every hospital I've been through in my past years, asking for my data back, right? According to GDPR, I have the right to at least get access to, in some form. I should have access in a digital, machine-readable form. But anyway, I was open to everything. After like 30 days, nobody came back. After 90 days, only one came back with a comprehensive file of all my data, out of all my hospitals. So you can understand, that something had to be done in that area, and that's, what Mama had to say.
Mattia, wow, man, 90 days. That took some time, and but at the same time, it makes us think. There, like, how much more work we need to, propel the health data ecosystem in general, making sure, listen, this is my data, I have a right to it, and it has to be organized for me to be able to retrieve it. So really critical steps forward, and I think we all have to learn from that experience from Juliano. I could feel the electricity buzzing through the WhatsApp conversations that we had in the past few days. And you come here, with a very, very interesting background from MonitoraKids, which you told me was a spin-off. Is that correct? How was your journey in the past 3 years? Tell me all about it.
Well, MonitoraKids is a spin-off from Dr. Kids, and so, startup focused on the pediatric public 0 to 14, and we are focused on low complexity, about 95%, How much people here have kids? About 0 to 14. Okay, it's a big client. The big challenge in the last 3 years, no doubt, is the pandemic world, and quick and wide change the model to online. The models don't like so much online consult, and traditionally we are, especially with a close touching human, it's difficult to, your kid diagnosed by online. It's difficult and all over the world. And so we create in a workflow using AI, that's a big keynote by John Stein, said a health voice AI. And we have discovered since 2017, we don't have freak mama or crazy families or grandpa, grandma worries too much. We have the bad guidance, a bad information, a low quality of consulting, and in fact, presentially, right? And our core business, in my opinion, is monitoring. And the pediatric is very, very the same default. And so we have the same questions, the same answer, and it's too easy to engage in AI and change the text match, then in audio and videos with the mothers.
Yes, like, you know, sometimes, you know, when I'm speaking to my son, it's as if I have to speak a totally different language. You know, it's not the same language that I speak with other adults, you know, it's like a totally different, like a different wavelength altogether. And with that, like in mind, I'd like to go to Mostafa Helmy, who is a GP trainee based in the UK. Is that correct, Mostafa?
Yeah.
And I love the fact that he said he's a digital health enthusiast. But honestly speaking, guys, when you are in digital health, you're a freaking pioneer because you are deciding to take a step forward and reinventing a space that many parts of it still haven't been reinvented in the past 100 years. So Mostafa, tell me about your journey in the past 3 years.
Yeah, so I think it's important to remember that a lot of the technology that's going to help us in healthcare is already out there. It's just about culture. So I'll give you an example. I'm a proper tech geek. A few years ago, I wanted to use Apple Pay. I was still a bit funny about it. What if it doesn't work? What if I look like an idiot in the queue? But one of the good things that came out of the COVID pandemic is it forced people to use technology that they already had. So everyone's already got smart devices that can do all these things. And an example in healthcare, which I think is quite powerful, is I was working in orthopedics for the last 5 years, so dealing with patients who have knee and hip replacement surgery. So in England now, over the last couple of years, if someone needs to have a revision surgery, so metal comes out and more metal in or whatever, we need to discuss it in a MDT or multidisciplinary team meeting. So how did that traditionally take place? A secretary would bring a trolley full of files this big for each patient, and we'd sit down, open the files and say, oh, what, you know, it was just rubbish. And so the attendance wasn't good as well from the surgeons. They might be on a different site, they might be working privately, you know, there's a couple of hospital sites. So we managed to kind of revolutionize that and just do that all digitally. So build digital forms so the information is stored in the same place, accessible anywhere, and also have better attendance for more clinicians because, you know what, you can access it on your phone from anywhere.
Well done, Mostafa. You know, sometimes we underestimate our efforts. We think that we need to kind of revolutionize the world, you know, go to like some great big meeting, shout our great vision. And really and truly, the solutions are much more simple and ingenious than we think. And with that in mind, guys, I'd like to invite you to vision now. You have a moment. You have all these colleagues here listening to us. And these next 3 years, what are you looking for? What are these lessons that we've learned? How are we going to move forward now? Prof. Grech, Fidek.
Like at hospital, we were talking about this, all the systems to be merged in one. If I want to book a blood test, it's one piece of software. If I want to book an X-ray, it's another piece of software. If I want to send a ticket of referral, it's another piece of software. And I can go on and on and on. It's extremely frustrating. There are systems I haven't bothered to get access to. One thing I'd like in hospital, I can't see anything changing in private practice. People will continue as they are because it's very convenient in a country like this, where they can just pitch up and see you. And what I'd like to do with my WASP course, since this is such a unique course, 3 days of how to write a scientific paper, I'd like to export it to other countries. Since I can, it's possible. And with an international faculty, it's even more possible now.
Wish you luck there, Vic. Markus.
I think all of you said many valid points from your points of view, and I think that's where the direction will head. So, for example, you said you want to merge everything into one system, and I think it's every country's responsibility to not only think in terms of what one country can do, because Malta with 500,000 people, you know, that would be a very containerized approach, but there are already international standards like the 𝐂𝐤𝐴7 API and so on, you know, so there are standards, and countries are building on it. Sometimes they're deviating from it, like Switzerland or something. But I think that will be the future, that this technology will get pushed, and there will be certain standards, like, for example, the data privacy, where you wanted to have all your data out and ask the hospitals. Sometimes it's simply not possible because it's a paper form. Your doctor is not going to spend 2 hours to type down and send you pictures or whatever, And sometimes even in Germany, it will be legally not allowed to even send you that information by email because it needs to be on a secure channel. So all those countries, they need to find some common ground, whether it's GDPR on the basic level or national data protection, where the data center is going to be, and so on. Obviously, there are also billions, and actually not billions, trillions involved. Germany alone has a healthcare budget of 300 billion a year. So there are lots of companies that depend on it, and they're not going to be happy if all the clinic systems are going to be merged in one. But I think those standards, technological standards, like Apple is getting forced now to use USB-C. I think this is going to happen over the next decades, not years, because it's billions. It's old. It's very highly regulated. It's not like crypto where they start regulating it. This is so regulated. You actually need to remove regulation to make it more worthwhile. And if it's actually giving an added value, and I think that's where the direction is going to be. If it's an added value for the physician, if it's an added value for the people that actually make money from it, like pharma and so on. If it's an added value for the patient, for example, if you have an electronic patient file where you have access to all your data, you can decide with whom you share it and so on, but you are the owner of your data. This is going to be the direction. The question is just how far are we able to influence it? As you said, we're pioneers, but obviously there are billions, and we are like tiny ants trying to move a huge mountain, the Mount Everest. And I think the more ants there are, the more we can influence the decision and push them to be faster. And I think the pandemic, as you mentioned, was a very good driver to force people to use the online part.
Well done, Markus. And when I think about all of this, I don't think necessarily of centralizing all in one system, but rather the persistence of data. Having the data that you need showing up in the system that you're using. Okay? And when I think of data, I think of Mattia. Mattia, thoughts? 3 years.
Yeah, I really have this picture in mind. 3 years from now, a patient, I'm talking, chronic patients, that's mainly what we focus on, like steps in the door of the doctor and says, hey, that treatment, I think is not really working. I still have this. I found other people in the other side of the country who had very similar to me, and now they're doing this other treatment. Can I take this? And the doctor says, yeah, but this is a side effect like this. And you say, okay, I want to take this. And then you take the new treatment. So I see this incredibly proactive role of a patient stepping in, managing their care, figuring out things on their own, bringing to their doctor, and together sharing the decision-making of what to do, what's next, to optimize each treatment. I think, you have two people in the room, right, and only one is thinking, right? You have another brain that is just there with a lot of more time at home to think about what can be done, and it's a waste, not to use that. So that's my kind of vision for the future and patient engagement. When it comes to data, I think it's just, yeah, I mean, access to healthcare data and having an integrated system has of course a lot of challenges. But I think, ultimately the patient and all the regulations are already there. Like GDPR provides everyone access to their data, and we're not talking about a new regulation. It's been here for years. So if someone is not complying with that, you can give them all the excuses of, yeah, it's hard, or it's complex, or it's paper, but you need to figure it out, right? That's the power of regulation. They come top down, and you have, usually no excuse to do it. So I think this is going to be the case in which patients will get access to their data. And I think it's also important to think, data is not just about, it's cool to have my timeline of all the things. When you integrate data, you can unlock new fields of research. Today, you have AI driving cars. Cool. How is that possible? You have incredible amount of data that has been used to train models, and now we're able to drive cars, right? With healthcare data, is not the same. You don't have those huge amount of data structured, clean together that are able to train models to figure out things, right? Of course, someone is narrowingly finding simple, like specific use cases for AI, but you don't have this huge amount of data. And so this can unlock research. And I think if we're going to get there to create this huge database, I think the way to go is through individual patients. So once each patient will get access to their data, then one solution will go to each patient and say, hey, if you want to share your data, this is the power that you can make. You can learn from others, and you can also contribute to research. And that's a little bit what Mama Health is doing, like helping people figuring out what's the best possible option for them to manage their care, but also sharing the data for a greater good of putting everything together and contribute to unlock new fields of research, medical research.
Yeah, I'm seeing a lot of common themes, data, persistence, I'm seeing systems, persistence, I'm seeing, this regulation. There's so many good things, we're looking for. We can, if we fight together, if we advocate together, through our different missions and through our different ways of living, I think we have really a bright future. And when I think about a bright future, I think about our kids, Juliano. So next 3 years, what are we going to do?
Before I was talking about the model in emergency, small emergency, and then now we are testing MVP phase. A little explore technology called 3D photo hologram. Imagine the situation. We take your phone, right? And you put it on your son. You take a picture. This picture is sent to a Power BI when the magic has happened. And we can estimate with a little error, like presentially, the weight and height in cephalic perimeter. This is too much easy to monitoring your growth and development around each by 14 years. And so it's difficult to everyone to understand, I get a picture, and this picture is a 3D image, and we get a height, the weight, and cephalic perimeter. This is I need, right? What everyone wants to say, what's the weight? Every worldwide, what's the weight? Oh, come on, wait. Let's send to the Power BI, and the AI adjunct tell me, Juliano, Stefan's son needs to make exam because the curve is not so very well. That's it. It's a new, but we are testing. Okay. Very MVP phase, and so, but it's very funny. Did you feel the impact of this?
Yeah.
In parts of the world, we don't have any doctor, any pediatrician.
Juliano, I really wish you luck on this this testing adventure, because I'm hoping that you build the strong evidence to make sure that what you deliver there is beneficial for everyone. And I really wish you luck there, and hoping that you do well. Mostafa, we've got a good minute to tell me what are the next 3 years? How can we digitally transform healthcare?
I'll try not to talk too quick. So at the moment, I'm also working in public health. So we're digitizing maternity records. So if a pregnant lady visits different clinics in the region that I'm working in England, that they have all the data up to date. One of the things that we need to think about as we accelerate our digitization is also digital inclusion or exclusion, because that can widen potentially health inequalities. So I'm focusing on health inequalities in terms of identifying how people engage with technology and what we can do to accelerate that. I won't labor the point too much because there's a few other things that I want to talk about quickly. So one of them is navigating IG landscapes, information governance. I recently implemented an app which took me a 30-page form, 10 meetings, nearly 500 emails to get done in more than a year. So it's just a complete nightmare. Also credentials, so how do we prove that we're doctors, that we've attended this conference, that we've got different things? Can we have a centralized place where we can store stuff? Data is very important, so how can we use data? Data visualization doesn't really happen that much for doctors. It's more for corporate people, but we need it for doctors so we have real-time information. And also things to do with decision support to help clinicians see the patients they need to see the most first, rather than at the end of the day when they can't get anything done for them.
Nice one, man. Such a packed statement there, and I loved it because now even how can I summarize all this? But if I had to bring all of this together as we close off this session, I know that our vision has to be 3 things. We have to work together, we have to advocate, and we have to think in the terms of data persistence, making sure that the data goes to the right place, at the right time, and at the right context. Thank you all. You've been all fantastic, and I really appreciate. Oh, well, what's that?
So this is from all of us. I would like you all to sign the back for our friend.
A big clap to all our staff. Thank you.